Brace for the numbers to keep getting worse. That's the message from the Premier after the state delivered another record of new COVID cases in this outbreak. Another 124 people have the virus, but the number that really worries authorities is this one, 48. That's how many were infectious in the community. A further 22 were infectious for some of the time. Gladys Berejiklian says the Delta strain is spreading like never before. Political reporter Ashley Raper begins our coverage.
Again, the news was bad. In fact, it's getting worse. 124 new cases is the most in a day since the start of this outbreak. And it may not stop there.
We anticipate case numbers will continue to go up before they start coming down, and we need to brace ourselves for that.
Among the cases today, 2 are staff members at an aged care home at Belrose on the Northern Beaches. A nurse from another home at Kirrawee in the south has also tested positive. It's shocking news for relatives. Janet McCaig is cut off from her 101-year-old mother, Violet.
Absolutely fear for my mother, but she's fine. She's well looked after.
A staff member at a disability group home in Parklea in Western Sydney unknowingly worked while infectious, and now another worker and 3 residents have the virus.
Public health unit has been investigating and making sure the other people are tested and isolated.
The workers at both aged care homes aren't vaccinated, but the majority of residents at the Belrose home are fully vaccinated and all are at Kirrawee, while both the workers and residents at the disability home have received their first dose. Across the city, the main concern remains the number of cases infectious in the community.
The fact that we have 48 people who are infectious in the community in the last 24 hours is not a good statistic.
A better one is that more than 85,000 people were tested in the same period, a new record. The time for making a decision on whether to extend the lockdown is creeping up on the Premier. Despite the numbers, Gladys Berejiklian is clearly hopeful that something will change between now and next week.
There will be still of course, a level of restriction on July 31, but the extent of that we can't convey to the community until we have more information.
Until then, there's a strong message about behaviour.
Any human contact is a high-risk setting.
It's best to stay home as ordered. Ashley Raper, ABC News, Sydney.
The grim news just kept coming today. Gladys Berejiklian says her fears about how the virus is spreading are being realised. Let's go to Kathleen Calderwood in Guildford. Kathleen, the list of hotspots just keeps getting longer and longer.
Jeremy, we've been hearing so much about Fairfield over the past couple of weeks, but COVID's been spilling into nearby areas. Take a look at this map. It shows the 6 councils where the bulk of today's cases have been found. Just after Fairfield is the Cumberland LGA, where I am, 23 cases here. It seems the Premier's warnings to stay home aren't getting through to everyone. She says too many families are still visiting each other and spreading the virus. But the other big danger are places that most of us can't avoid.
This family grocery is on the front line.
A little nervous.
They haven't had a case, but the Sharifis know selling essentials can be a risky business.
I think it's important for us to remember that people do need their groceries, but for us, we need to ensure that we're maintaining the health orders.
ما تلاش میکنیم برای راحتی و برای از اینکه کمیونیتی ما آسوده و آرام باشن و خطایی و ناراحتی نداشته باشن.
2 Sydney supermarkets are among the city's latest exposure sites. A staff member who worked for more than a week at Woolworths in Belrose has tested positive. And there's been a scare at this store in Merrylands.
We're all in it together. We've just got to deal with it. I just wish more people would wear their masks, do their QR coding.
Feeling no good, very sad.
More and more cases are emerging in sectors that can't be shut down.
Buying groceries, going to the pharmacist, having to undertake critical work.
But a union says some workers are being put in unnecessary danger.
We've still got members who are being required to serve customers at the front door, not click and collect, but actually put stools out so they can try on shoes.
Staff who live in parts of southwestern Sydney but work in other council areas are required to get tested every 3 days.
But here in Liverpool, there's confusion about whether they're included in the surveillance testing program. The Health Minister has told me at this stage it only affects workers from Fairfield and Canterbury Bankstown. That could change in the coming days.
Even that won't catch all house-to-house transmission.
Unfortunately, when our health experts are interviewing families within households, we're learning that they have visited families in other households.
With devastating consequences. Kathleen Calderwood, ABC News, Sydney.
Businesses in regional communities forced into lockdown are calling for better financial support. There are no new cases of COVID in the Central West today. Joanna Woodburn is live for us in Orange. Jo, so far so good, but plenty of people are still waiting for their test results.
Jeremy, there's been a five-fold increase in the number of tests in the past day, so Central West residents are really doing what they can. There is relief that no new cases have been reported today, but there are still a few days before the immediate threat will pass. But this lockdown is starting to hurt businesses hard. Many shops have chosen to shut or reduce their hours, even if they're allowed to trade, because there are so few people about. Tom Ward's vineyard in Orange has been in lockdown for 2 days, but his business and others have been hurting for a lot longer.
From the first shutdown we saw in Sydney, that had an immediate effect of tourism coming out here. I mean, Orange is a tourist destination. They're a huge part.
He's lost 80% of his customers, city residents who can't leave Greater Sydney. Shops across the Central West are shut. The normally bustling main streets are almost deserted. Government support is available, but not all regional businesses are eligible.
We can't be treated like an extension of the Sydney lockdown. This is the Central West lockdown. We need to know what the rules are, who's open, who's not, and what we're eligible for.
At least 8% of Australia's GDP comes from regional New South Wales. The Central West alone contributes $13 billion. With local businesses now hemorrhaging money, they're pleading with the state government for more support.
I've written to both the Treasurer and Agricultural Minister today to see what financial assistance can be provided to certain industries in the agricultural sector, locally, wineries and vineyards and so on.
Almost 10% of residents in Orange, Blaney and Cabonne have turned out to get tested. Authorities hope these high rates continue so the lockdown doesn't last. Joanna Woodburn, ABC News, Orange.
As the number of cases continues to rise, so too does the number of people who are seriously ill in hospital. There are now 118 people in hospital. 28 of them are in intensive care. 14 need ventilators to help them breathe. Of those in hospital, 42 are under the age of 55, and of those, 15 are younger than 35.
There is nobody currently in intensive care who's had 2 doses of the vaccine. So we know the vaccine prevents serious illness. There is currently nobody in intensive care who's had both doses of the vaccine of any age.
And the numbers are rising quickly. There are now 4 times as many people in hospital and ICU as there were 2 weeks ago. Experts are warning that winding back restrictions before most of the population is vaccinated would be deadly. Younger people are still waiting for their chance to get a jab, but some GPs are finding that older Australians are putting off getting the AstraZeneca jab in the hope of receiving a Pfizer shot.
Sydney's rising case numbers are concerning but not unexpected.
We're now dealing with effectively a completely new aspect of that virus that operates in its own horrendous way.
Modelling recently conducted by the University of Sydney suggested this could take up to 2 months to control, so long as residents dramatically reduce their time in the community.
So if you used to do your shopping, grocery, joining events for 10 hours a day, now you can only do so for 1 hour.
Some warn without introducing tough restrictions last weekend, large swathes of people would have been infected by now.
We would be looking literally at thousands of cases a day right now.
While Sydney plays the waiting game to see if restrictions work, health officials say vaccination is the only way out.
There's only one real solution. At the end of the day, it's get vaccinated.
But they're finding take-up of what's available in Sydney still seems to be an issue.
The day before yesterday, there were about 9,000 Pfizer vaccinations given in our Homebush or Olympic site hub, and 50 were taken up by AstraZeneca.
It's a similar story at this GP clinic in Newtown, where plenty of AstraZeneca jabs are still readily available.
What we can't have is people aged over 60 or aged over 70 waiting around for a Pfizer that may or may not appear at the end of the year.
Doctors aren't expecting ample amounts of Pfizer to arrive until at least the last quarter of the year. They're calling on any supplies to be diverted to the most vulnerable communities of Greater Sydney as they arrive. Josh Bavis, ABC News.
Queensland will shut its border to all of New South Wales from 1 a.m. tomorrow. The usual border bubble will be in place, but locals will only be able to travel into Queensland for a limited range of reasons. Case numbers are also rising in other states. Victoria reported 26 cases. That's the highest figure for a single day so far this year. All but 2 were in isolation. South Australia has 2 new infections, a brother and sister in their 20s who attended a winery. A record number of tests were conducted, but there were long lines again today.